Dr. Starziak here, and we are looking at a patient who has ice pick scarring from picking her chicken pox that she had when she was a child. Pretty deep scars, pretty dramatic, and what I'm going to show you in this video is, and her forehead looks fine, I'm going to show you in this video a treatment where we completely got rid of her scars. So here we're using our Fotona Dynamis. I have it on turbo mode, and it's turbo 4, so I'm delivering 4 pulses. Each pulse is taking 30 micrometers of depth, so all 4 of them together take 120. I'm covering every scar with this 3 times. So I'm going down 360 micrometers wherever there's a scar. And the reason that I'm doing this is because I want to get beneath the scar tissue. That's the way to resolve a scar. If you can totally ablate all the scar tissue, then the cells beneath the scar tissue will grow all of those layers back, but they'll grow them normally. Now, this person here has a Fitzpatrick skin type 4. So we are being sure to use the chiller to help decrease the risk of hyperpigmentation, also to help with the discomfort of the procedure. As you can tell from her eyes, there is some discomfort here in this procedure. She used topical numbing. We have other pain management solutions, but a lot of people don't want to have something that changes their level of consciousness, and they want to try to manage the pain with just topical medication, and we totally can do that. In situations where it is too intense, we can always convert to using something to help with the pain. So that's not a problem at all if someone wants to try doing it without. But generally for a deep procedure like this, unless you're really hardcore, I recommend that you plan to do something to help with the pain. Now, as you can see, she has some tattoos on her arm, and she let me know here that the pain is about equal to getting a tattoo. So now that I've covered all of the area with the scars, I'm going over and going to do a full pass with 120 micrometer depth on her entire face. And the reason that we're doing this is just for some skin tightening, for evening of skin tone. This is not a totally necessary step in this process. We could have simply left it at what we did. Well, actually, we do need to go down deeper in the scar area, so we could have just gone over all the scars one more time and left the rest of the skin alone. But we decided to go ahead and do a deep peel on the rest of the face as well. It does make it a much more difficult procedure to tolerate without having additional pain medication. So you can see in her eyes that she is exercising her willpower to get through this. It also is going to mean that at the end, the burning sensation on the face is much more than it would be if we just left it at treating the scars. Now, if we're using pain medication, what I do is I keep the concentration of it high enough to keep someone unconcerned until about an hour after the procedure is done. At that point, the burning sensation is dramatically reduced. It's pretty surprising. You'll see that after this treatment, the pictures show a significant removal of the upper layers of skin, and there'll be some blood. You'd be pretty surprised how quickly that pain diminishes to insignificant. It's really about an hour, 2 hours out. It's no longer significantly painful. It's just that first 1 to 2 hours after, and of course during, if you're fully conscious for it. But this patient did really well with this treatment. She has a great pain tolerance. Some people wouldn't be able to come close to tolerating this without more assistance. During the healing procedure after this, there's not a lot somebody has to do. They just have to stay out of the sun, like pretend they're a vampire, stay out of the sun, and keep Aquaphor on their face. You wash your face twice a day with a gentle cleanser and reapply Aquaphor after each wash. You can even reapply it 3 times a day. We can accelerate the healing with aloe. Aloe will actually make it heal faster. Exosomes too. At the time of the treatment, we can apply exosomes. And with her, because we were going so deep, we actually did. We used Chimera's exosomes on her face to accelerate her healing and also help mitigate post-inflammatory hyperpigmentation, which it worked really well. You'll see our end results are fantastic. So it's a great treatment. But if you have an aloe plant at home, every time you wash your face after this, you could apply aloe before applying the Aquaphor. Additionally, there is a skincare product called Regenerative Skin Nectar from Alastin, and that's a great one to use 3 weeks leading up to and for a week after doing deep resurfacing, even 2 weeks after doing deep resurfacing. It has some peptides in it, and it's formulated to be able to be used directly on skin. You may be noticing about the lidocaine we reapplied to the areas on our cheek that we already treated. We're doing this to decrease the pain sensation for our next pass. And, you know, this could cause a little bit of irritation in that area. It can sting a little bit, but it's not going to cause any significant harm. It may slightly increase our risk for post-inflammatory hyperpigmentation, but because of the degree of pain that she was in with this procedure, it's just, you know, the lesser of two evils, if you want to use that term, since she didn't want to use pain medication. We reapplied it and it ended up working pretty darn well. So this procedure, all in all, took about an hour. So it's not a very long one. And there you can see I'm wiping off the lidocaine from that area. We actually lost the video before I finished everything. Like, I hadn't gotten to do the whole forehead. The phone died while I was recording. So you won't get to see the entire treatment, but you definitely get the sense of what it's like. You can see from her face what you would be enduring if you didn't use pain medication. But to me, this is encouraging because you can see that it's tolerable without anything more than topical numbing. So if you use something more, then all right, it's definitely doable by pretty much anybody. You just need to have a ride home if you're using the pain medication, or plan to hang out here for about 2 hours after it wears off to make sure that you're able to navigate home safely. The area around the mouth actually heals twice as fast as the rest of the face. So if someone just wants to treat the wrinkles that happen around the mouth, smoker's lines, or all these just little fine wrinkles, we can target just that area with a deep treatment. And even if you go as deep as you can, it heals in just about a week. And as soon as the epidermis is healed, then you can start wearing sunscreen so that you're able to be a little more liberal going outside. But you still have to be careful with the sun, because when we go past 125 micrometers, we're going to begin to remove the melanocytes. So the melanin that protects the deeper layers of skin from the UV rays from the sun, that will be dramatically decreased, or if we go deep enough, it will just be gone. So the skin really needs time for that to heal and then for that melanin to repopulate before it's subjected to UV rays. All right, so here's the after, right? Pretty intense. Got a little bit of bleeding where the scars were. That's expected. We have Aquaphor over it. That's why it looks all shiny. And then this is a couple days later. You can see the areas where we went deeper. They just describe where all the scarring was. And then the rest of her skin looks significantly lighter. And look at this. This is like a couple months later. All we see is a little bit of redness where the epidermis is still going back to its normal thickness, so we can see the dermal blood passing through. And this is even a little more resolved. And then gradually those little red circles completely resolve to where her skin now is just smooth and the scars are gone. This is exactly what you want. So this can be done in a single treatment. There's just some downtime, and it takes a while for that pinkness to resolve, a few months.